If you're a woman in menopause, you need to hear this. The commissioner of the FDA basically said this was one of the biggest mistakes in medicine in the last 25 years. And women for 2.5 decades have been suffering because of fear of hormones. Menopause is a hormone deficiency. And in medicine, we treat all other deficiency by returning levels to optimum or normal. In my practice, we return them to optimal, not just normal. But so many women stop their hormones suddenly, and then through the grapevine, don't take hormones, they cause breast cancer. Don't take hormones, they cause risk. And then women who were given hormones see this warning by the FDA on the label saying, make sure that you really need it before you take it because it's dangerous. So of course women have been afraid to take hormones. You may not remember this. I was early in my practice. I completed my residency. I had completed my time in the Air Force. I was actually at the end of my time in the Air Force when that evening news hit, end of 2002, October, that said the Women's Health Initiative was halted early because of an increased risk of breast cancer, and it didn't decrease your risk of heart disease. And that threw women's health care into a tizzy. Women saw that on the evening news, and then, they even saw it before the doctors that were involved could review the studies. And that's a travesty. The problem is with all the studies that came out after that showed, well, they didn't use the right women. The women were too old. The average age was much older than newly menopausal women. Of course, it didn't prevent heart disease because when you start hormones in a woman that is in her late 60s or early 70s, she probably already has heart disease, and you can't prevent something that's pre-existing. And then, with the breast cancer, they didn't use the right hormones. They used medroxyprogesterone acetate, which is not progesterone. They used Premarin. Number one is from horse urine. Number two, it's oral. And we should always use transdermal estrogen to bypass the liver. When you digest a supplement or a medicine, the first place it goes from your gut is to your liver. And the problem with estrogen is when it goes to your liver first, it turns into inflammatory mediators. They're released, and that's what increases the risk of heart attack and stroke of birth control pills. I think, unfortunately, there may still be women out there and doctors out there who are purporting that hormones are dangerous. The good news is hidden. Bad news hits the press immediately, and good news and retractions don't make it to the front page. So I'm here to tell you that if you are newly menopausal, you are a great candidate, most likely, for hormone replacement. We do know that the benefits of hormone replacement are the highest if you start it within 5 years of menopause. Doesn't mean you shouldn't start it if you're past that window, but it just means you're not going to get quite as much benefit because your body is dealing with 5 years of hormone deficiency, and adding that back maybe doesn't give you all the benefits as if you had replaced those hormones immediately. Women deserve to know there is no clinical evidence that hormone replacement therapy increases mortality from breast cancer. That's huge because so many women are afraid of breast cancer. They're not distinguishing the difference between hormone replacement types. They lump everything together: Provera, progesterone, Premarin, estradiol, oral, transdermal. They're just calling it hormone replacement therapy. But even if they're saying that those things have a slightly increased risk of breast cancer, well, I'll argue with you that I don't think the bioidenticals do. There's no increased risk of mortality from breast cancer. And so we do know that it increases your risk of brain health. Here's something for you. When I have women who ask me, how long should I take hormones? It's like, well, when do you stop needing your brain? When you don't need your brain anymore, that's when you can get off your hormones. That's not really a truly measurable effect. Hot flashes are measurable and they're instantaneous, right? When we stop the hot flashes, we know immediately. But the preservation of your brain health, that's huge. That's the fountain of youth. Your brain is the fountain of youth. We want to protect our brains. Decreased risk of heart disease if started early. Decreased risk of colon cancer. Improved joint health. There's so many benefits of hormone replacement therapy. Doesn't mean it's for everyone, but you know what is for everyone? The conversation. So please go to your doctor, a trusted guide that will listen to you, discuss hormone replacement therapy, and make a decision that's right for you. Hormone replacement therapy, yay. I think the gaslighting is at its near end. I'm hopeful, but we need to watch what happens. And please be your own advocate.